and which in turn will affect or cause disease. Our aim
Okay.
of treatment to restore
Sorry,
the
ma'am.
balance.
Can I
Audibility issue?
just interrupt? No, no, ma'am.
Yeah.
So Sattvic is not considered as a dosa.
No, sattva is not considered as a dosha. It is the
Okay.
prakrita guna of manas.
Okay. Okay. That's why. Okay.
It's
All right.
prakrita.
Thank you. Thank you, ma'am. Okay, ma'am.
Yeah. So,
Doctor,
Rajas,
can you just explain Rajas and Tamas to us, please?
okay, yeah, I shall. Okay. So to bring back the vitiated doshas to normalcy is prakriti sthapana. Prakriti is the natural way or the balanced state. To bring back the vitiated to normal state is prakriti sthapana. Now moving on to
Prakriti
manasika
Sthapana.
doshas, they are rajas and
Okay.
tamas. They are rajas and tamas. Now to go ahead with rajas and tamas, I'll give you certain examples. Okay, rajas and tamas. When we talk about when we see somebody, who is always clumsy and who likes to sleep, who is always clumsy and likes to sleep. Okay, that comes under tamas. Rajas is who is always, ready to fight, ready to what you call quarrel, etc. are rajasika gunas. Okay,
Okay.
and sattva. Sattva is a guna. See, sattva, rajas, and tamas are three gunas of the manas. But sattva is, we don't consider it as a dosha because it does not undergo vitiation. We always say or feel that sattva gunas, it's not there around in commoners. It's not there in commoners. But sattva guna is present in, basically, if I have to give you a classical example, then that is in the God. Sattva gunas are present in God. In current days, we can take sattva guna to be present in with whatever little vitiation. Still, we can consider sattva guna to be present in our Prime Minister Narendra Modi or anything people or humans who are into all pious activities, who are into doing good deeds. Those can be considered as sattvika gunas. Okay, if I talk about terrorists, if I have to talk about terrorists, then they are Naxalites. They come under Rajasika Guna. Okay.
Yes.
Some people under Tamasika Guna who are, being very, what you call, lethargic, untidy, being unhygienic, all those comes under Manasika. Manasika. Again, if you actually go deeper, these will be again clubbed with the Pitta and Kapha doshas. These will be again clubbed with Pitta and Kapha doshas or Pitta and Vata. Again, doshic variations. Tridoshas are functional aspects of the body. They form the basis of physiology, pathology, and pharmacology. Tridoshas are the basis for physiology. Physiology is the normal functioning of the body. Physiology is the normal functioning of the body.
Functioning of the body. Okay.
Pathology is abnormal change which has caused due to vitiation of the doshas. Abnormal change which has caused due to vitiation of the doshas. Physiology, normally the skin is what you call the smooth and lustrous. Pathology, the skin has become dry. That is pathology. Pharmacology, you are giving some oil application, you are giving Shira Balataila application, that is pharmacology. That is pharmacology. Physiology is the normal functioning aspect of the body. Pathology is the abnormal functioning of the body, abnormal state, I can say, abnormal state of the body. Pharmacology is the considering the vitiation of doshas, you are going to use your mind or brain and advise some medications, that is pharmacology. Okay. Physiology, you are exposed to some allergen, you sneeze once. Physiology. But you are having allergic rhinitis, so you keep on sneezing 20 to 30 times once you are exposed to the pollen. That is pathology. I give a medicine called Bruhat Haridra Kanda. I am going to help in preventing the repeated attack of sneezes. That is pharmacology. I'm going to advise treatment nasya. That is pharmacology. Here, doshas. Doshas are omnipresent. They are present all over the body. See, one thing you need to understand, doshas are present all over the body. If I say head is the place for kapasthana, when we were talking about eye, we said Anjana, we said I is Kapasthana. So when we talk about that, that means Tridoshas are present, but Kapha dosha is much more present in the body. Kapha is much more than Vata and Pitta. It is the permutation change. And these doshas, they are present all over the body, and they are spreading in the body through the processes. They are spreading in the body. Just ignore that to this point. Okay. Tridosha and Pancha Mahabhutas. So we know there are 5 Mahabhutas. Now let's see what combination brings or makes in which dosha. Okay. Combination of Akasha, that is ether, and Vayu. Vayu and ether or Akasha forms the dosha Vata. Pitta, Agni and Jala makes the dosha Pitta. Kapha, that is earth and water, makes the dosha Kapha. Makes the dosha Kapha. Now, though all the doshas are present all over the body, the doshas are omnipresent. Doshas are omnipresent. Still, in the upper part of the body, it is the Kapha dosha which is predominant. Kapha dosha which is predominant. Now, next coming to the stomach and the upper GI, it is the Pitta dosha which is predominant. Coming to the lower part of the GI, it is Vata dosha which is predominant. Upper part of the body is Kapha predominant. Middle part of the body is Pitta predominant. The lower part of the body is Vata predominant. Okay, Vata predominant. So we are classifying the doshas based on how they are located in the body. When I say here, I said it is Kapha is located, but I do not say Kapha is located. I say Kapha is predominant. Here Pitta is predominant. Here Vata is predominant. That means along with Kapha there are Pitta and Vata. Along with Pitta there are Vata and Kapha. Along with Vata there are Kapha and Pitta. Okay. Tridoshas. Now, see, we say there is a famous quote which says, Yat Brahmanda Tat Pindanda. So, whatever we see in our environment is there present within us. Whatever we see in the environment is there present within us. According to Acharya Sushruta, see, we see sun, moon, and air in the environment, in our surrounding. The sun can be, the activities of sun can be equated to the activities of Pitta. Activities of the moon can be equated to the activities of Kapha, and that of air to be associated with Vata. So we are comparing the sun, moon, and air to Pitta, Kapha, and Vata. Now the sun, it has the drying effect, the Shoshana activity. Our water bodies, they get dry in summer. Why? Because of the intense heat of the sun, Grishma Rutu. So this drying effect is there in Pitta. Moon, coolant and strengthening, like our Shishira and Hemanta Rutu. Because there it is moon or moon which is predominant, or it is Kapha dosha which is predominant. We are all able to do our activities. We are able to lift our hand. We are able to lift our hand. It is because of Vata. See, I will tell you, just remember this line. Just remember this line, and all of you should give me examples now. Okay. Any activity in the body is happening, any movement, you can take it as movement. Any movement is happening in the body, it is because of Vata. Simple. I am moving the cursor up and down. That is because of Vata. Okay. It is because of the movement of my hand. For that particular finger to move, it is Vata which is activating. Okay. You are going to open your laptop, or you're going to shut down your laptop, you're going to switch on the button, etc. They are all movements of Vata. Now, all of you give me one example of some functions happening in the body, you can correlate it to Vata. See, I say any movement happening in the body is due to Vata. So I will expect all of you to start answering.
Yoga.
Sir,
Okay.
blinking
Somebody
eyes.
Yeah, blinking eyes. Very good. Breathing is good. Very good. Breathing is also due to Vata. It is importantly, it is Pranavayu. See, Vata is further divided into Prana, Udana, Samana, Vyana, Apana, Panchavatas. Now, as you rightly said, breathing is an important activity of Vata. That is because of Pranavata. Very nice. Yes. Somebody told
Digestion.
yoga to perform different postures. We need Vata. Correct. Yes.
Yeah,
Digestion.
blinking.
Blinking of the eyes is correct. Digestion, I'll get back to it.
Yeah, walking.
Walking, a person is able to walk, it is because of Vata. Correct.
Even our talking is because of Vata.
Yes.
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 Our speech.
Yes. Because of Vata.
So everything that
That
we
is due to
perform.
Vata.
So any form of exercise would be Vata.
Yes. Perfect. Perfect.
Things like
If you want
sneezing,
Vata,
coughing.
Vata.
Okay. We
Okay.
understand.
Yes.
Yeah.
So, yeah, good. So now we have understood that certain movements in our body are due to Vata. So one of the participants answered the digestion. Okay, digestion activity is due to Pitta. Digestion activity is due to Pitta. The main function, like as we say, important function of Vata is among various important functions. We say movement is due to Vata. Similarly, digestion, the work of digesting, okay, the release of the gastric juices, okay, that is all due to Pitta. Now,
Pitta.
once the food is, now just understand here, there is slight difference. You need to understand the food. See, whatever you have eaten, you take some food and you chew. Your chewing action is Vata. Okay, when you are chewing, there are certain salivary juices that are acting on the food. That action of salivary juices on the food that is there in your oral cavity is Pitta. Okay, that which is helping in digestion is Pitta. Now, the inner lining of your mucosa of the mouth, your mouth is having one layer in center, one layer, all of you can feel that. Touch it with your
Yes.
tongue. Your mouth is having one coating. That coating is nothing but Kapha. That coating is nothing but Kapha. Okay. Now, once you have eaten the food, once you have taken the food into oral cavity, now from the oral cavity, it is traveling down the esophagus, reaching the stomach. So this motion or this movement of the food from the oral cavity down the esophagus to the stomach is the activity of Vata. But the breaking of the granule size, the breaking of the granule size is again due to chewing action, that is Vata. But there are certain juices which are acting on it, that is the activity of Pitta. That is the activity of Pitta. Now this same food, what you have eaten is churned, is crushed, then it is churned, then it is pushed to next part of the body. Crushing, churning movement, the stomach is having some movements, and then it is being pushed to the lower GI, then to the upper GI, then it comes to the rectum and it is evacuated out. From the time you have taken your food in the oral cavity till the time it comes out in the stool, it has all the activity of Vata which is helping in its movement, which is helping in its movement. Think of a vehicle. Okay, all your commuting part is done by the Vata. Commuting part is done by the Vata. Okay, now important function of Pitta is this thing. What you say, Pitta is it helps in digestion, it helps in metabolism, it helps in metabolism. Now coming to the functions of Kapha. Kapha is it has, you know, it does the soothing effect. Or another thing I would say, you are having certain movements in your joints. The movements in the joints. Okay, if the Kapha in the joints reduces, if the Kapha in the joints reduces, then it is the function, then it is a disease there, what we call as osteoarthritis. Then we come across a condition called as osteoarthritis. Why? Because joint is the place where Kapha resides, important sthana for Kapha. But if the Kapha decreases in the joints, then that's the time one is suffering from osteoarthritis of the knee joint or any joint of the body. The person is suffering from OA of that particular part. OA of that particular part. Okay. Okay. Now, yes, there is diurnal variation. That means throughout the day, the doshic variation takes place in the body. It is natural. It is physiological. It is physiological. Now, what happens to Kapha? or when is Kapha dosha predominant in the body? We are see all of us are doing Vyayama. We came across Vyayama, that is exercises in Dinacharya. We are supposed to do Vyayama in Dinacharya, Rutacharya. So this Vyayama is to be done 6 a.m. to 10 a.m. Sorry, Kapha dosha is predominant during 6 to 10 a.m. Hence, we are advising Vyayama. When we are doing Vyayama, when we are doing exercises, Kapha dosha decreases. Kapha dosha is decreasing. Hence, we are supposed to do Vyayama in the morning. Next, 10 to 2 p.m. is Pitta Kala. 10 a.m. to 2 p.m. is Pitta Kala. Then 2 p.m. to 6 p.m. is Vata Kala. Okay. Next, 6 to 10 p.m. is Kapha Kala. 10 to 2 p.m. is Pitta Kala. 2 to 6 a.m. is Vata Kala. 2 to 6 a.m. is Vata Kala. See, whenever I get patients, I ask them, they complain to me of itching. They complain to me of itching. Okay, they're having itching all over the body or anything. So whenever I ask them, I ask them at what time do you feel itching? Is it morning, afternoon, or night? So when I ask them morning, afternoon, or night, I'm trying to hint at the dosha that's been involved in that particular person. Dosha that's being involved in that particular person. They say it is in the evening, they say it is in the night. Then if it is in the night, okay, 6 to 10 p.m. Kapha Kala, Kapha dosha involved. If they say, no ma'am, my headache increases, when it's like afternoon, 12 o'clock, 1 o'clock, I have severe headache. Yes, it is migraine due to pitta involvement. Due to pitta involvement. So that is how. So understanding the dosha predominance in the body according to the time, we can help, or it will help us in treatment. It will help us in understanding the dosha involvement in a better way. It will help us in understanding the dosha involvement in a better way. Is this clear?
Yes, ma'am.
Yes.
Yeah.
Doc.
Early
Yes.
part of the day
Yeah.
Kapha dosha, mid part of the day Pitta dosha, end of the day it is Vata dosha. Again, early part of the night Kapha dosha, mid part of the night Pitta dosha, early part of the morning it is Vata dosha.
No P. PQRSTUV. Uh-huh. Yeah. I getting that from the letters K, starts with K alphabetically, P, and then V is the last letter.
Yeah.
Hmm.
Okay. Now, Tridoshas and Shadrasas. I think we came across Shadrasas in the previous classes also. Now, we know Madhura. See, let me explain, or you can just write this down somewhere. Madhura is sweet, Amla is sour, Lavana is salt. Okay. Madhura, Amla, Lavana. Sweet, sour, and salt. These three rasas, they pacify Vata doshas. They pacify Vata doshas. Tikta, Katu, Kashaya, that is bitter, pungent, astringent, they pacify Kapha doshas. Kashaya, Tikta, Madura. Kashaya, astringent, bitter, and sweet. They pacify Pitta dosha. They pacify Pitta dosha. So, among the 6 rasas we have 3 rasas that control the Vata dosha. We have 3 rasas that control the Kapha doshas. We have another 3 rasas which control the action of Pitta dosha. So, 3 rasas control the action of Vata dosha. Now, whenever I feel Vata dosha is aggravated in the body, then I need to take substances which are having Madhura, Amla, Lavana. Madhura, Amla, Lavana. Okay. Whenever I feel Kapha dosha is aggravated in the body, to pacify the aggravated Kapha dosha, I need to take Tikta, Katu, and Kashaya rasa. Whenever I feel Pitta dosha is increased in the body, I should take Kashaya, Tikta, and Madhura rasas to decrease the increased Pitta. To decrease the increased Pitta.
Ma'am, some example of some fruits or vegetables,
Yeah, I shall give now. Okay.
please.
Now, when I know there is Vata dosha aggravated in the
Yes.
body, there is Vata dosha aggravated in the body. Now, I'll give examples here. Fruits. Okay, I'll just give here. Kapha dosha is aggravated in the body. So assuming you are having cough, whenever you cough, there is sputum coming out of the body, okay, of your oral cavity. Hope you got my point. Phlegm is coming out from your oral cavity. Then that time, what you are supposed to choose is katurasa. What you are supposed to choose is katurasa. So katurasa is nothing but the spices. All of you may be aware of this thing. What do you call marich in English? Marich. It's Piper
Chili?
nigrum. Not chili. Black pepper.
Marich? Black pepper? You mean gulmarich?
Yeah.
Okay.
Ah,
Okay.
okay.
Go
Black
on.
pepper. So that time you need to use for productive cough. You need to use black pepper or long pepper. Crush that long pepper or black pepper. Mix it with honey. Mix it with honey and then take it.
Okay.
So that will help in reducing the kapha. We are advising black pepper or long pepper because it is having katurasa. Because it's having katurasa. Okay. Whenever
That
you are
comes under
having,
katurasa.
yeah, that comes under
Okay.
katurasa.
Okay.
See,
Well,
it's not that always combination of all three rasas. Different condition, different rasa. Sometimes combination of two, sometimes combination of three. Next, you are having complaints of hyperacidity. You are having complaints of hyperacidity. There,
Okay.
when you are having hyperacidity, wherein you feel like you feel burning sensation in the stomach. In that condition, I ask you to take cold milk, sugar, cold milk along with sugar. Okay, milk is Shita, milk is Madhura Rasa, sugar is also having Madhura Rasa. So it will pacify Pitta. Now, diet modifications, you don't find any improvement in the condition, then I'll give you a medicine called as Panchatikta Grita, which is having bitter taste. Or you are going to have foods which are having bitter taste like bitter gourd. That will be your diet supplement. Then that comes under Pitta Rasa. That comes under Pitta Rasa.
Okay.
Okay.
All right. Yes.
See, to understand what to apply, you need to like have a basic idea of the rasas which are predominant in the substances. Rasas which are predominant in the substances. We have one more class on home remedies, I think. There you will come to know, at least you may not remember, but once you go back to the slides, there it's written which medicine is having which dosha which rasa predominant. So you can cross check that.
Okay.
Okay. Yeah.
Yes, ma'am.
Now, simplified understanding, Vata is responsible for all the movements, initiation and control of the activities. Initiation and control of the activities. Now, just I'll give you an example here. Now, I have around roughly we are around 7 to 8 members in this session here. Now, what do you feel? Anybody who is having an urge to eat food right now?
no.
No, ma'am.
So, if assume person had an urge to eat, it is the
Me,
hunger
I
stimulation center. Yeah, so one of them is having. So hunger center is stimulated. That stimulation of the hunger center is done by Vata. Now, here I see my participants saying they're not hungry. So that means Vata has initiated their satiety center, saying that stomach is full, they don't need much more food. So that satiety center to be stimulated is also under the control of Vata. So initiation of an activity, control of the activity is under Vata. You see a snake, you run away from that place, it is due to Vata. It is due to Vata. Okay.
What
Next.
about getting angry with something for some reason?
That, that is Pitta.
Pitta.
Anger
Oh,
comes
that
under.
is pitta. Okay.
In
Uh,
anger, you
Yes.
beat somebody, getting angry is Pitta, beating somebody is Vata.
Okay,
After you
that is
have
because
beaten,
movement is there.
yeah. And then once
Okay.
you are angry, okay, then just you try to calm down or you go into a state of depression after you have had a fight with your near and dear ones. Going into the
Okay.
state of depression or remaining calm and uh, in a state of not able to do anything is kapha.
Okay.
Okay, or you tend to sleep off. Okay, that state is kapha. Pitta performs digestion, metabolism, heat regulation. Yeah, I hadn't mentioned this heat regulation. Now, Whenever we get fever, our body becomes hot. That means Pitta dosha is aggravated. That means Pitta dosha is aggravated.
Aggravated.
Sometimes on exposure to cold, your body temperature goes down. Pitta has reduced. Pitta has reduced.
Reduced.
Kapha function, important function is protection. Important function is protection. Now, when we are going to extreme cold or extreme heat, okay, we are still able to sustain. That sustenance, that stability is given by Kapha. That protection at that particular place is given by Kapha. You are able to walk for 5 kilometers. That is because of Kapha. One person is able to run for 5 kilometers. That is a good activity or a good strength given by Kapha along with Vata. Okay, you're able to walk, that endurance, you can understand the endurance nature. You're able to endure much more, then that is Kapha. Now, if we have 3 participants, one is comfortably running and reaching the race of 5 kilometers, another is reaching only 3, another is reaching only 1. Good strength, moderate strength, mild strength. If one person is not able to reach 5 kilometers, that means increase his endurance, increase his Kapha. Along with Kapha, we also need Vata for action, for the movement. But that endurance nature is done by Kapha. A person is able to sprint for 100 meters. Okay, that is sprinting for 100 meters. One person is able to sprint. One person is able to see. There is a difference between sprinting and going for marathons. For sprinting, you need good speed. That good speed is given by Vata. You're able to run for 5 kilometers, it's given by Kapha. Okay, you're going to be a very sharp shooter, that is Pitta. Sharp shooter, you're going to, that's Pitta. Where your intelligence comes into picture, where your focus comes into picture. Somebody is able to play good chess, that is Pitta, good intelligence. In that same chess, if somebody is, fastly attacking the opponent, that is Vata. Somebody takes time but gives a good move in the chess, that is Kapha.
Doctor,
Mm.
I just want to find out the center of feeling hunger. Now, we have people who ask like they want to lose weight and why they're eating so much all the time. Is that something within a center in your body that creates that hunger?
Yeah, see, there are, it is due to the body's mechanism or due to their metabolism in the body that they have increased cravings. See, one may be pathological, that means abnormal, the other may be physiological. See, we find some people who eat very often, but they eat very little quantity. Very little quantity and eating very often is Prakrita. But there are some people who are having increased hunger, then that comes under pathological. See, like, let's not mix, but see, anytime if somebody is asking for food repeatedly, then that is due to hunger center stimulation only.
Okay,
that is
Can
due
it
to
be because of sugar problem, diabetic problem? There's a tendency to eat more.
yes, can be one of the reasons. One of the reasons. Okay. Now, going to the different systems in the body, nervous system. Nervous system is the system which is connected with, like, if you attend the anatomy sessions, I think these will be a little, lighter to understand. Nervous system is all the nerves in the body. Nerves in the body are under the control of Vata. Endocrine system, digestive system is under the control of Pitta. Immunity, whatever we talk about immunity, that immune system is under the control of Kapha. This is rough correlation of Vata, Pitta and Kapha to the systems, to the various systems present in the body. Now, I think we have all studied this in our schooling. Okay, I think 8th to 12th standard, we have all studied this. It's a image of a human cell. So just trying to understand the functions of Vata, Pitta, Kapha over there. I have just put in my effort. Now here, we have the cell membrane. This cell membrane, what does it do? It does the permeability. Now, now think of a tea filter. It has small holes. Hence, when you pour the hot tea into it, it what you call it prevents certain large particles from going out through it. It prevents the movement of large particles and only fine particles. Similar is the action of cell membrane. So this cell membrane is helping the movement of substances in and out. So the movement of substances in and out helping is the function of vata. Vata. We come across mitochondria. We come across mitochondria. We call this as powerhouse of the cell. We call this as powerhouse of the cell. So that is due to pitta. It is synthesizing the ATPs. That is the function of pitta. We have this blue color cytoplasm. We have this blue color cytoplasm. So in the cytoplasm, we are having the cell organelles. We are having the cell organelles. It is providing the space, or it's lodging the other cell organelles. That is the function of kapha. That is the function of kapha. Okay.
Yes.
Okay. Understanding of Tridosha with respect to animals. So I've just try to understand this. We see birds flying very high. So the movement of these birds is vata. We see lion, which is known as king of the jungle, and it intelligently attacks its prey, pitta. We see elephant, which is having good strength, endurance. That is kapha. Okay. Now here I'm talking about predominance. That doesn't mean the bird does not have pitta kapha. The lion doesn't mean does not have kapha and vata. This does not mean it does not have vata and pitta. Yes. Again, talking of birds, eagle can fly much more higher. Vata. It has very good eyesight. Pitta. It attacks its prey also very well. Pitta. Okay. Shall we move to the next slide? Yes. So with a slight understanding or a few inputs regarding Vata, Pitta and Kapha, moving on to Prakriti. Now, yes, what is Prakriti? See, one thing you understand maybe in Hindi, people who are well versed in Hindi, Prakriti is just the nature itself. Prakriti is nature. So Prakriti is defined as the state of an individual in its natural form. It is the natural form, how that person is.
Yes.
We as Ayurveda doctors, we classify humans based on the Prakriti. We classify humans based on the Prakriti. What Prakriti does the person belong to? Every person is supposed to have a fixed Prakriti that is formulated by the condition of three doshas at the time of union of sperm and ovum inside the uterus. So Prakriti of an individual is is designated, is created, is formed at the time of union of sperm and ovum. At the time of union of sperm and ovum. So always, whenever I told you in the first session that we are advising Garbha Paricharya for the pregnant ladies. So when we talk about Garbha Paricharya, or care of the pregnant ladies, even there is something called as preconceptional care or preconceptional counseling. So we always tell the couple who are planning for conception, to have sexual intercourse with a very good, calm, and with a very good mindset, because at the time of union of sperm and ovum, whatever is the mindset of the parents, that same will be carried on to the child, and the child will live with that particular trait throughout his life. So having a calm mental state or a very good mental state at the time of union of sperm and ovum is of highest importance. It's because Prakriti of an individual is designed, is formed, is created at that particular time. Predominance of one, two, or all the three doshas determines the Prakriti of an individual. A person may be Vata Pitta predominant, Pitta Kapha predominant, or Pitta Vata predominant. Next. So Prakriti refers to genetically determined anatomical, physiological, and psychological constitution of an individual. So Prakriti refers to genetically determined because it is in the genes that it's there, that the union of the sperm and ovum at that time, it is in the gene what is there and how is it transferred? It is transferred anatomically, that means with respect to the shape of the body, etc. Physiological condition, the normal functioning of the body, psychologically, the mental function of the body also. Okay, so Prakriti is very important for us for many aspects. Yes, Prakriti
Doctor?
also determines. Mm-mm.
Sorry, before we move on, what percentage, rather the DNA that's from a memory point of view is in the sperm and in the ovary as well, that's transferred into a newborn child?
Memory.
Yeah, the DNA of a sperm and the DNA of a ovary.
You mean which gene is responsible for the memory?
Yes, that's right.
Okay, I really don't know which gene is responsible for memory. I'll cross check and let you know.
Okay, and how much of DNA is taken from it's? I know there was a amount, I've forgotten about it. That the certain percentage, not yeah, like 350 kilobytes or something of that side. It's in the sperm and same in the ovary. I just wanted
See,
to, yeah.
for the determination of the sex of the fetus, it is the male. If it is XX present, it is a male child that's going to be born. If it is XY, it's a female child that's going to be born.
Okay.
Okay. Yes. Opposite to the Prakriti is Vikriti, which means diseased state of an individual. Opposite to the Prakriti is Vikriti, which is the diseased state of an individual. Until the normal is not known, abnormality cannot be found. So Prakriti plays an important role in determining the Vikriti. Now, I told you, now we have to know our normalcy. This is important again. Next, I'll be asking you a few questions. You have to think of yourself in your normal state. Assuming now you are having fever, and I ask you, is your body hot, cold, or hot, medium, hot, or cold? Then simply you are having fever right now, and you write it as hot. No, you have to think of yourself when you are healthy. Okay, answer all the subsequent questions, assuming yourself to be healthy, how your body is. Think of that and answer the questions. If we understand the natural nature of our body, then we can understand the abnormality that is seen in our body at that particular point of time. Okay, so Prakriti emphasizes on the individuality and plays an important role in diagnosis, in preventive medicine, and therapeutics. So based on Prakriti, we are able to emphasize on the factors like diagnosis. Now, diagnosis, I'll tell you. See, diagnosis, I think you might have come across many diagnostic centers which will give you your blood tests, your X-rays, your CTs, MRIs, etc. Your diagnosis is it's going to help us in what do you say, in naming a disease, okay, or some parameters it will give us. So based on Prakriti, we can say if a person is Vata Pitta Prakriti, we can assume that yes, he is prone to Vataja disorders, he is prone to Pittaja disorders. Preventive medicine. When I know Vata Prakriti person, see, a person is Vata Pitta Prakriti, he is a Bharatnatyam dancer. Okay, Bharatnatyam is a form of Indian dance, which wherein there is too much of movement of your hands, facial expressions, and the body. But yes, because of the movement, they are prone to knee joint osteoarthritis. They are prone to knee joint arthritis. A person who is Vata Prakriti is many a times prone to osteoarthritis. That is our diagnosis from the Prakriti. Now, preventive medicine, since he is a Bharatnatyam dancer also, he is supposed to get osteoarthritis at the age of 60, but he will get it at 45 because of his wear and tear in Bharatnatyam dance. So I will give a preventive saying you have to massage your knee joint or you have to massage your body, or if no time, at least massage your knee joint and other joints of the body so that you can prevent yourself from attack of osteoarthritis. Okay, preventive medicine. I am being cautious that my knee joint is undergoing wear and tear. Okay, for that she will use Ksheerabala Thaila or Mahanarayana Thaila, that is the therapeutics.
Ma'am, one more question. Um, when we see a patient coming to us, we how can I say? For example, that person used to be um, in one particular prakriti, but it can change also, right? Gradually, somebody can change their prakriti.
See, Prakriti will not change. Prakriti will not change. It is determined at birth, then it remains constant.
Okay.
Doctor, that means if someone uses their joints more than that's normal, this is where they
Yeah.
will have a problem. I mean, like the example you just gave us now about the
Yeah,
Bharatanatyam dancer.
yes.
Now, say, for instance, we do like something like mobility yoga. That means rotating your ankles or your knees and hip and so on, all the joints, and as a yoga exercise form. Will it make it worse or will it be preventative?
No, see, if you are doing it within limits, if you are not abusing, I would rather use the word abuse. If you are not abusing any particular part of the body, then that is fine.
Okay, thank you.
When we talk
Gentle
about
is all
Bharatanatyam
right.
dancers,
No movements.
see, when we talk about Bharatanatyam dancers, they usually to perform one dance, the beginners, especially, they practice a lot. They practice around per day 2 hours. So they are overstraining there. They are overstraining there.
So, what can they
So
do?
If they had, then it would have been all right.
if they had,
For
sorry,
preventative medicine, for that kind of person who's using too much of that part of the joints, what can they consume so that to help it and prevent that to happen sooner?
yeah, so they can consume something called as Kirabala drops. Drops are available. You can add those 2 drops into milk and take it, or simply take milk along with ghee on a daily basis. Consume milk along with ghee. So having osteoarthritis at the early age is vitiation of Vata dosha. We need to pacify Vata dosha with Madhura Amla Lavana Rasa, as we read in the first previous slides. So Madhura Rasa, or the sweet taste, is milk. Sweet taste is ghee. Milk and ghee help in nourishment. That can be given internally, or else Ksheerabala drops can be given internally. Ksheerabala oil can be given externally for application, or simple massage with coconut oil, olive oil, any oil that's local to you and is nourishing in nature, that can be given to them. Or, and we studied about, or we came across in the first session, we came across Janu Basti, wherein a bridge is built around the knee joint and medicated oil is poured. That treatment can be adopted before even they have their onset of OA. So that's going
Doctor,
to replenish the joint.
doctor, is that because of the fat content in all these things which you're saying about the ghee and milk and so on, that the fat content helps that and prevents the inflammation as well?
Yeah, it is the fat content, not inflammation. It is a degeneration. It is going to so we go on to the next part.
So Prakriti is a physical attribute or mental attribute?
It is physical, mental, both.
Both.
Prakriti is
Mental can
derived
be
from two
changed. No? Mental attribute can be changed, no? To some extent.
No, see, mental attributes can be changed, but the origin, what you call, the like, see, everybody has, whenever we are born with certain traits. We can pacify them to some extent, but it is not gone. But it is not gone. See, I have a patient. Then I have a patient who complains of anger, and he is interested in controlling his anger. Then I will send that patient to Reji's Wellness Center. I will tell Reji, I will refer it to him, saying that advise him some pranayama and some deep relaxation techniques, which will help in reducing his anger. So that anger component is there in that individual, By doing pranayama and yoga are taught by ladies, it will be pacified to some extent, but it is not totally gone. We can subside it to some extent. The same with the physical traits also. Same with the physical traits. Some
But over a
person,
period of
see, we
time,
talk.
over a period of time, if you mature, your habits and traits undergo a change actually. A person who was very, arrogant and responding to the early ages of life, over a period of time, when he
Yes,
matures, he becomes calm and composed. That's also possible that
yes,
Prakriti
yes,
changes
perfect.
to some extent.
Exactly, that's
No,
what I was asking, Doc. Like kids, for example, in the beginning, they're very calm and
Yes.
quiet and very happy child. But by the
no,
time they achieve teenage and all, they become very aggressive and angry and complaining kind of thing. So that's what I was thinking. Like Prakriti will
okay.
change.
No, shall I answer for this? We have
Yes, please.
physiological. In the first slide, I think we came across this physiological change. In the childhood, there is kapha dosha which is predominant. In the youth age or in the teen, it is the pitta which is predominant. There you have burning. You see all the revolts and rebellions. We see all the youngsters there, and all the retired people are having vata. All the retired people are having vata. So one of the friends has rightly pointed that a person in his early age is more aggressive, but in the older age he's calm and composed. In the middle age, he is more aggressive. It is because of pitta dosha, which is predominant by nature in all the humans. And by old age, when you reach, it is vata dosha, which is predominant. So the prakriti is remaining constant. Due to the change in the age, the doshas are changing. It is the physiological change in the body, not the prakriti change.
This is also
Okay, thank you.
noticed,
Nicely explained. Good.
Doctor. This is also noticed in when you say in youth and so on with the animals like lions and tigers. They also, when they're at certain age, they become a little more aggressive and a lot
Mm.
of more energy there. And is it because like the males have the more increased in testosterone?
Yeah, it may be. It may be. But here in Ayurveda, nowhere we have explanation with respect to the sex. Like I told you, with there's diurnal changes, there's physiological changes with respect to age, etc. I told. But in Ayurveda, we don't have reference of differentiation between the sex, male and female. We don't have.
Hmm.
It's not given in the classics. But yes, we are practically observing it.
Hmm.
Okay. Okay.
Okay. So Prakriti
Yes, ma'am.
is termed as the first creation. The term Prakriti also means nature or state of an individual in its natural form. Prakriti of human being depends on genetic and acquired factors. Now here, when we talk about genetics, is the what you say one set of traits what affect the Prakriti formation of Prakriti is the mindset, the nature, how the few days, like 15 days to 1 month or 3 months, how the recent past, how the couple have spent time with each other, or how they have been faced, or what situation they are being facing in their workplace, etc. They have an impact on their psychological condition. Next, the place where the union of sperm and ovum happens, like we see, like the climatic conditions with respect to the nature. Is it? I told you,
Hmm.
Sharad Rutu is very good for conception. Okay, the climatic condition. Okay, some like what do you call, the geographical conditions also have an impact of the child which is going to be born. A, a person whose conception has taken place in case of April, May, Grishma Rutu, the bala of that particular person will be less. The child which is going to be born will be more of Vata Prakriti predominant, because Grishma Rutu, because of the climatic changes, there's going to be Vata predominant in the body. Okay, similarly such factors will play a role. Say I always suggested my friends, during the COVID times, I told them not to plan for conception. I told them not to plan for conception because the geographical conditions were not feasible. So the child or children, you can just observe in your close circle, if anybody has given birth during the COVID time, they are sure shot being going to be prone to upper respiratory tract infections because of the climatic condition at that particular time. Because of the climatic condition at that particular time. Okay.
Doctor, does that mean when you say climatic condition and they can be affected by COVID, is that also the energy that's flowing around, the energy and vibration that's flowing around, because people are now so into that part, and because of respiratory thoughts, so the thoughts itself could affect that factor?
Yes, it will affect. It will affect. See, thinking, you said about thoughts. The thoughts are nothing but the psychological thoughts or the emotional thoughts. So emotions have a role. See, whenever see in India, whenever we come across any pregnant ladies, we don't ask them to work, because yes, the body cannot do so much of physical work. One thing, because of the developing fetus. Next, we always treat them very piously. We take care of them very well. Why? Because the mindset or the psychological state of the pregnant woman has an impact on the child. Hence, we take care of her very passionately and treat her with compassion.
So she needs a lot of support that time.
Support and also a mental peace. We ask them to read Ramayana, Mahabharata, books of
Mm.
spirituality, undergo meditation, etc.
Mm.
All these are going to help in having a positive or a good progeny. We want a good progeny. See, everybody is getting a child. Everybody can beget a child unless you are infertile. Everybody can beget a child. But begetting a good progeny is of utmost importance. Nobody would like to say, I am the mother of what you call the terrorist. Okay, I am Osama bin Laden's mother. Nobody would like to say. Everybody would proudly say that I am Modi's mother. Yes, because what uh, what you are going to impart to the society has an important role. And see, we come across people. We come across. I don't know if you are an Indian, you would have heard about Sudha Murthy. Sudha Murthy is a very good speaker. Okay, and she is owner of Infosys company. See, Sudha Murthy is an well earned, well financially settled lady, and we also have the Ambani brothers. Okay, I'm just giving examples of famous people in India.
Yeah,
They are
now
also
we know heard of him as well. We heard of him. Yeah.
yeah. Yeah. So Ambani brothers are also rich financially. Talking about Sudha Murthy, who's financially rich, Ambani brothers who are financially rich. When we talk about Sudha Murthy, she has done so much when North Karnataka was flooded. Okay, she has done lot of donations, and she gives lot of charity talks, and she does lot of charity to the needy. She visits when India faced Bhuj earthquake. She has visited the place personally and spoken to the people and approached to their needs. Okay, that is Sudha Murthy. But when we talk about Ambani, both Sudha Murthy and Ambani brothers being both financially good. Ambani brothers are much more financially richer than Sudha Murthy. But they are being rich for themselves. They are not contributing anything to the society. So you can understand the difference in the mindset.
Aha. Aha.
Yeah, just you being to yourself and you're not giving anything to the society. I feel that's being selfish.
Absolutely. Absolutely.
So I feel we should beget a child with good moral values, ethical values. I don't mind a child not pursuing or not getting first grade in his 10th class or in grade in +1, +2. But having good moral and ethical values, minimum respect for the elders, and leading a normal life without harming others, I feel that is a good progeny than excelling in your marks, and then you meanwhile you have copied, you have cheated, or you have bribed your teacher and getting first grade is of no help.
Hmm. So that means also the countries that been where it's a lot of abuse in that country. There's war, terrorism in that country. So those times are really bad for children as offspring from those countries.
Yes.
Mm.
Yes.
So
Mm.
a constitution depends on environmental factors, age, race, heredity, climate, season, and region. Yes. To
Mm.
acquire into the child, all these play an important role. All these play an important role. Simple with respect to age. You are conceiving at the age of 21, 23. The sperm and ovum are much more healthy. You are having good health, but you are conceiving at the age of 35, 38. You are little aged, though you are there in that pitta kala, but you can understand the difference in the age groups. One thing, when you meet gynecologists at the age of 35, so they say high risk pregnancy and they load you with medicines. No doubt, you are being forced to get some diseases, so they give you medicine. But you just think of yourself practically. Your child, who is at the age of 23, gets married and he's going to beget a child. And think of your own child who is marrying at the age of 35 and be getting a child. There is difference. So the age race to which we belong, yes, the similar race traits will be transmitted to the children. Okay, climate, season, region. Yes, next. So moving on to different types of Prakriti, we have Eka Doshaja, that means one dosha Prakriti, Vata, Pitta, and Kapha. Dvandvaja, that means two, combination of two, Vata, Pitta, Vata, Kapha, Pitta, Kapha, combination of three, Vata, Pitta, and Kapha. Okay, let's see. All of us, we are all normal human beings. So we belong to this two type Prakriti, that is Vata, Pitta, Vata, Kapha, and Pitta, Kapha. Okay, based on certain traits which are common to one particular dosha, we are going to analyze the Prakriti. Traits, so somebody asked, is Prakriti only physical or mental? So traits belong to both physical and mental. Certain questions asked in relation to the physical and mental state, you need to answer. Yeah. Meanwhile, just all of you keep your pen and paper ready, or your scribble pad, anything. It may be your electronic device or your book. Keep a scribble pad ready and answer the questions. Okay, at the end of answering 10 questions, you can analyze your Prakriti. Next, there's a clause here. 10 questions aren't sufficient, but to just give an insight, I have chosen 10. Prakriti questionnaire link. Right now, last time I tried sharing the link, it wasn't working. So I have a software. I just hope I'll be able to send it across and you're able to download it and answer the questions. Okay. Okay, so here we have first question. Keep your scribble pad ready. So we have with respect to body frame, person who is thin, bony and small framed hardly gains weight how much ever he eats. Next, person who is medium built can gain or lose weight easily. Next, third person who is large built can gain weight easily, but he is able to lose weight with difficulty. He is able to lose weight with difficulty. We have three body types. If you belong to the category 1, you can mark yourself question number 1, put A in front of it. Question number 1, if you belong to the medium build, put B. If you belong to the large build, put C. Okay, shall we move to the next question?
Please.
Walk and talk. Fast walk and talk, A. Moderate and determined walk, B. Slow and steady walk, C. If you belong to A, write question number 2 and write A. Belong to B, mark B. Belong to C, pen down C. Shall we move to the next one?
Yes, please.
Weather reaction. Enjoy warm climate but feel uncomfortable in cool weather, mark A. If you are enjoying cool weather and dislike warm climate, mark B. Comfortable for most of the year but prefer summer and spring, don't like damp climate, mark C.
Mom, again.
Yeah, it's visible on the screen.
Sorry. I can't see that.
Okay, shall I repeat?
Okay. Please. Because I'm using a telephone.
In cool weather.
Enjoy warm climate but feel uncomfortable in cool weather, mark A. You enjoy cool weather and dislike warm climate, mark B. Comfortable for most of the year but prefer summer and spring, don't like damp climate, mark C. Answered?
Yes, ma'am.
Yes.
Sweating. Sweat little but not much. Have minimal body odor, mark A. Sweat a lot, have medium body odor, mark B. Sweat moderately but sweat a lot when working hard, have strong body odor, mark C. I'll repeat. Regarding sweating, sweat little but not much, have minimal body odor, mark A. Sweat a lot, have medium body odor, mark B. Sweat moderately but sweat a lot when working hard, have strong body odor, mark C.
Yes, ma'am.
Okay. Appetite. Irregular. Sometimes I feel hungry, sometimes I don't. Mark A. Strong and sharp. Forget the word sharp. Strong. That means increased appetite. Always feels hungry. Mark B. Decent appetite. Have tendency to eat for comfort and taste. Mark C. Irregular. Sometimes feels hungry, sometimes no. Mark A. Strong. That means increased appetite. Always feels hungry. Mark B. Decent appetite. Have tendency to eat for comfort and taste. Mark C. See, at the end, you have to have see, some people for some like see, for question how I expect the answer to be is question 1A, question 2B, question 3A, question 4C. Like that, I want you to have A, B's and C's. Okay. Sometimes if you have an ambiguity wherein you fit into both A and B, you fit into both B and C, then you can mark both the alphabets and then let me know. Moving to the next question. Skin. Normal to dry, rough, thin and cool skin. Skin issues like dryness, dullness and wrinkles. Mark A. Normal to oily, soft, reddish, sensitive and warm. Skin issues like inflammation wherein there is redness. Somebody slightly beats you and your skin becomes red. B. Normal to oily, soft, thick and cool. Skin issues like excessive oily skin, itching, fungal infections. Mark C. Normal to dry, rough, thin and cool skin. Skin issues like dryness, dullness and wrinkles. Mark A. Normal to oily, soft, reddish, sensitive and warm. Skin issues like inflammation. Mark B. Normal to oily, soft, thick and cool skin issues like excessive oily, itching, fungal infections. Mark C. Hair. Rough, dry and wavy. Split and split. Mark A. Normal, straight, thin and brownish. Mark B. Thick, curly and oily. Hair color tends to be on darker side. Mark C. Rough, dry and wavy. Split and split. Mark A. Normal, straight, thin and brownish. B. Thick, curly, oily. Hair color tends to be on darker side. Mark C. Shall I move to the next question?
Yes.
Lips and teeth. Have thin lips that tend to get dry. Teeth can be somewhat uneven. Teeth may require constant attention. That means it's for teeth. Have next. That's A. Medium-sized soft lips. Upper lip slightly darker than lower lip. Teeth are medium-sized but tend to suffer from cavities. B. Large and smooth lips. Teeth are well formed and aligned and requires less care attention. Mark C. Moving on to the next question.
Yes, ma'am.
Small eyes, small in size, feel dry and Eyes often blink a lot. A. Medium in size, often gets reddish eyes. B. Big and attractive, thick eyelashes. E. Cracking sounding joints, small forehead, nails crack easily. Mark A. Black moles on body, medium-sized forehead, nails are pink and soft. Mark B. Disproportionate body like heavy thighs, hips, etc. Large forehead, nails are wide and whitish. Mark C. So I have asked all 10 questions with respect to physical characters.
Red,
Yes,
nails, crackies, no. Black moles.
these are just 10 questions.
Gym.
In the software shall be saying it has both physical and mental characteristics. Okay. Has everyone finished answering all the 10 questions?
Yes, ma'am.
Okay. Now, I want you to calculate the number of A's, number of B's, and number of C's.
Six.
Ma'am, some questions can be both like A and B or A and C.
Yeah, 10.
Okay, okay.
Now, any one of you quickly tell the two highest,
Yeah.
like you may have 5 A's and 4 B's. And
Four A's
hmm,
and five C's.
so you have to say which is highest, you need to say first 5C and 4A. So let me
Yeah.
disclose it to you. A belongs to Vata, B belongs to Pitta, and C belongs to Kapha.
Sorry, ma'am, can't hear you. Some disturbance is still going on.
No, screeching
Okay.
stuff.
Okay.
So,
A is Vata,
A is Vata, okay. A is
B is
Vata.
Pitta, B is Pitta,
B is Pitta.
C is Kapha.
C is Kapha. Okay.
Now let me know you have 5 C's. So Kapha is
Yes.
5 and
Okay.
Vata is 4.
4. Yes.
Pitta is 1.
Pitta is 2.
Pitta is 2. Okay. So you belong to Kapha Tridosha Prakriti.
Okay. Okay.
Okay. Anybody else can answer?
Yes, my scores. 2 A's, 6
Mm.
B's, 1 C, and 1 A B.
So that again becomes to 7 B's and 3 A's. So
Yes.
you belong to Pitta Vata Prakriti.
Yeah, okay. Thank you.
Doctor, mine. I have 6 A's, 3 B's, and 2 C's.
Okay, so you belong to Vata Pitta Prakriti. Okay.
And mine, I
Now,
have 4 A's, 4 C's, and 5 B.
5B, yes. So you belong to Pitta and Kapha Vata. So since you have Kapha and Vata equal, yes, then we need to have furthermore questions. Or I think I can just seeing you physically, I should be able to tell. Okay. Now see, we see this. You can take it as what you call this can be 30 to 40% correct in assessing your Prakriti because we haven't considered mental traits and it's only with few features we are able to guess the Prakriti. Okay. So having vast questions, answering all of them, I think we should be able to guess. Sometimes again we have this ambiguity like how your friend has here. she has similarity between two doshas. Again, asking a few questions or answering certain physical traits, we shall be able to finalize the Prakriti. Okay. Is this clear? If somebody else who wants to say their food can say or the next part.
Yeah, thank you.
Yeah. Moving to the next part. Importance of Prakriti. Promotion of health. Ayurveda encourages person to take foods and indulge in those activities which are opposite to his or her Prakriti to live a healthy life. A person is prone to Vata Pitta Prakriti. Eating again Vata Pitta Ahara, that means foods that aggravate Vata Pitta, then that is the aggravation of Vata Dosha. So, if a person is Vata Pitta Prakriti, eats foods which are Kapha, which are going to increase Kapha in the body, or foods that are going to satisfy Vata and Pitta. So, by doing this, you are going to promote your health. Agni status of inducement. A person who is Vata Prakriti have Shabagni, that means disturbed. Sometimes have appetite, sometimes no. Sometimes who is Pitta Prakriti has an increased appetite. Sometimes who is in Kapha Prakriti or someone who is having Kapha Prakriti has decreased appetite. Okay, Samadosha Prakriti who is having Vata Pitta and Kapha inequality.
Sorry to interrupt. Can I just, I can't hear. I think the sound is very, very bad on my side.
Yes,
It-
ma'am.
it's-
It's really.
It's a
We
lot of
can't hear
screeching sound.
anything that you said.
Oh, just a minute. I will
Okay.
log out and log in again.
Okay.
Okay, thank you.
Yes, ma'am, please.
And you're getting a screeching side on your sound on your side.
I am on our side.
Yes, on my side as well.
Yes. This is a very interesting lesson. Gosh, it's
I think everybody will try to find out the prakriti of their home.
Right, right. Now we're coming to test
Yeah,
ourselves. This is the
Yeah.
biggest test.
So
Very
can I just ask something? If we have a Vata Pitta Prakriti, do we have to have more Kapha foods to eat?
you are quite evenly distributed.
yeah. So yeah, that's what we have to ask, like how to make a balance of them, right? Digestion
Terrible.
Now, they said we must have the
Not
opposite,
disturbing.
eat opposite to what we are in domination. Which, if we are dominated in pitta, then we must have the other type of foods that's to kafar and to vata. You know, that kind of thing.
Yeah, like we have to pacify, right? We have to pacify some kind of thing that
Yes,
we are
yes.
predominant in our prakriti, right?
So we got to
So,
complement.
yes.
Shall I continue?
Yes, ma'am.
Because
Determination of Bala, that's the strength. The comparative strength of different individuals can be decided by the type of Prakriti. The Kapha
Doc,
Prakriti
sorry,
person.
Doc, sorry, can you just go back 2 slides because we haven't heard anything that you've said. The sound was very bad.
Okay, here.
yes, yes.
Yes, thank you.
Yeah, we are able to promote the health by understanding or by having a knowledge of the Prakriti. How? So, by taking the Ahara, that's the food, by doing activities which are opposite to our Prakriti, helps in having a good, healthy lifestyle or healthy life. Moving to the status of Agni, if a person is Vata predominant Prakriti, he will have Vishamagni, that is the disturbed appetite. Sometimes he has hunger, sometimes he doesn't. A person who is having Pitta Prakriti will have an increased appetite. Any part of the day you give him, offer him food, he will be able to eat. Pitta Prakriti. Kapha Prakriti, the appetite is reduced. Mandagni. in Samadosha Prakriti, wherein Vata, Pitta, and Kapha are in equanimous state, there a person will be having Samadhi. Now, a strength of an individual can be determined based on understanding the Prakriti or knowing the Prakriti. Kapha Prakriti persons are stronger than Pitta and Vata Prakriti persons. If we have Vata predominant, Pitta predominant, and Kapha predominant Prakriti people, Kapha predominant Prakriti people are the ones who are having more strength. We spoke about endurance is in the Kapha Prakriti people. Determination of strength is important for us while we are treating a patient. Susceptibility to disease or productive medicine. Each Prakriti type is prone to specific diseases. As I said previously, Prakriti determines proneness of an individual for dosha specific diseases. For example, Kapha Prakriti person is prone to diseases due to Kapha. He may suffer from loss of appetite, running nose, or prone to obesity or diabetes mellitus type 2. Okay, person who is having Vata Prakriti is prone to abdominal tumors or even osteoarthritis. Person who belongs to Pitta predominant Prakriti is prone to acidity, anemia, jaundice, bleeding disorders. So, understanding the predominant Prakriti, we will be able to gauge as to which disease that person is going to be prone to. Accordingly, the modification can be done before the disease is manifested. Vata, Pitta, and Kapha diseases are a little difficult to treat in persons belonging to Vata, Pitta, and Kapha Prakriti respectively. Understand this, person who is having Vataja predominant Prakriti, if he gets disease which is prone due to or which is caused due to Vata predominance, then treating this disease is difficult. See, same Prakriti, getting the disease of the same dosha, difficult treatment becomes difficult. Now, assuming Mala belongs to Vata predominant Prakriti, if she gets osteoarthritis, then it is a little difficult for us to treat. A person belonging to Kapha Prakriti suffers from Vataja disorders, easy to treat. Clear? Same predominant Prakriti, same predominant dosha, difficult to treat. Kapha Prakriti suffers from Vataja dosha disorder, easy to treat. Clear? Shall I move to the next point? I'll give you an example here again to understand. Person who is belonging to Vata predominant Prakriti is prone to dryness of the skin. You give him moisturizer in winter. After half an hour again, that moisturizer has gone, his skin again remains dry. Person who is Pitta Prakriti, because of the winter changes, he suffers from dry skin. You apply body lotion, his skin remains unctuous or smooth. For Kapha also it's the same. But Vata predominant Prakriti, if there is Vata Prakopa in the skin and the skin becomes dry, how much ever body lotion, how much ever Abhyanga, you are going to get prevent it only up to 20 to 30%, 70% of the disease still remains. Clear? No? If anybody has understood, you can explain it to me in your own words. I'll add on. If none of you have understood, I'll go on.
Okay, I can try. I am like Vata Pitta Prakriti. So if I have osteoarthritis, it will be difficult to treat. I can only treat it to maybe 20 to 30%. But if I have maybe something with Kapha, it will be easy to treat because that's not my Prakriti.
Yes, perfect. That's the right example. Good. Yes, the others have understood. Shall I move to the next point?
Yes.
Yes.
Yes. In view of this fact, the different diseases to which individuals predisposed can be predicted scientifically. or postponed by appropriate diet, drugs, or regimen. Now, how do we manage this? For
I'm sorry, your sound is again very distorted.
now,
Still.
Yeah, we cannot hear your voice.
okay. Hello.
Hello.
Can you hear you now?
Yes, we
Yes,
can.
ma'am, it's better.
Yes, it is.
Yeah.
Okay.
Okay. Now we can apply this concept in treating the individuals. Ayurveda always gives individualistic medicine. Why? Because we know that we are all different in our prakritis. We are all different based on our prakritis. So Acharya Charaka or all the other acharyas, all the other ancient saints. So according to them, it is Prati Purusha Siddhanta. Each individual is different in advising the treatment. Each individual is different. Why? Because of the inherent nature of Prakriti. Okay. The knowledge of Prakriti helps in drawing a line of treatment for a diseased person. Okay. So that's more of treatment aspect. I'll just leave that part. Determination of drug doses to quantify the amount of medicine. For that also we need Prakriti. So to diagnose a disease, to treat a disease, and also to choose the quantity and the drug, we are dependent on Prakriti. So the base for our treatment always lies in knowing the Prakriti of an individual. To conclude, knowledge of Tridoshas is basic to understand Ayurveda. As a result, Prakriti also can be understood. A thorough knowledge of both, that is the doshas and Prakriti, help to prevent the diseases and also know about the susceptibility of the diseases. Thank you. Any questions from your side is welcome.
Ma'am, what is the oil name for vata, for knee joint or any joint?
Ksheerabala Taila.
Shirabala.
Ksheerabala Taila.
From where we'll get?
It is available in all the Ayurvedic pharmacies, Ayurvedic medical stores. If you are from North India, Patanjali stores will surely have it.
Shirbala taila for knee joint and back pain also, no?
For back pain, if it is degenerative, if it is age related, if it is in the elderly patients, go for Mahanarayana Taila or Vishagarbha Taila.
Mahanarayana and
Vishagarbha. Vishagarbha Taila.
this is also will get Patanjali.
Vishagarbha Taila is not there in Patanjali, but Patanjali shopkeeper will surely tell you where you can get.
Okay.
Then
So
Adhi
how long we
Kapeshwar
should
there.
use it?
See,
How
sir,
long we should use
see,
it?
see, how long I cannot tell without seeing the patient or the condition.
Okay.
But if you are having osteoarthritis, then usually we repeat treatments for them every 3 months once initially, or 1 month once based on severity. If it is less severe, 3 months once initially, then maybe make it 6 months once, then yearly once. I am treating my mother for osteoarthritis since last 10 years. Initially, it was every 3 months once. Now it is yearly once. Yearly once, just as a maintenance due to age-related wear and tear. My mother is 67 now, so I started her treatment since last year. 67. She was
That to some extent it is reversible, you mean to say.
to some extent, it is managed.
Managed, okay.
Hot, hot oil
Treated
or
her.
normal oil?
What is?
Oil should use hot or normal?
Oil has to be warmed. Oil has to be warmed for better results. For better results, oil has to be warmed. You have to do an indirect heating of the oil. Take a container, take a wider container, put water into it, keep the water for boiling. In a small bowl, add this oil and put this bowl with oil into the water containing utensil and heat the oil. Then remove the heated oil from the container and apply it. The oil has to be indirectly heated.
And doc, is that also because of better absorption?
Yes, that helps in proper absorption, better absorption.
Doctor, when you look at the various things like the kapha and so on, and can we also meditate on those things where we lack those elements?
Yes, you can.
Thank you.
Doc, can I ask a question? Is there many other questions that you need to ask to find out the prakriti of a patient?
Yes, yes, there are many other questions. See, for an Ayurvedic doctor, just gazing at you, we can advise, we can understand your prakriti, or just a few questions we can understand. But for commoners and for for Ayurveda enthusiasts, or for the yes, without much knowledge of Ayurveda, it becomes a little difficult. So various number of questions will be needed. That's it.
Okay. Will you be able to give us a list of maybe the other questions?
Yes, I will try to send across the software if possible. If it's possible, then it's well and good. Else, I'll try to send a questionnaire.
That'll be great. That'll be great. That's our homework.
Yeah. Okay. Shall we end the session, or any questions are welcome?
Doctor, thank you very much. That was a brilliant session, very nicely explained, and I like, for my hearing, it did help me tremendously when you repeated yourself. So thank you very much for that, because my absorption was far more greater today. Yeah, thank you.
Yes, ma'am. Thank you so much.
Thank you, doctor.
Pleasure.
Namaste,
Thank you.
ma'am.
Thank you.
Thank
Yeah, welcome.